Good afternoon. I do apologize for the delay. Technology is great when it works, right? I am Alexa Smith, and I am the Educational Exchange and Event Program Manager with the Office of International Programs. Thank you to those who joined us in person and online, both in the United States and in Ghana and Peru. We're glad you could join us. And we have a message from KUMC's Senior International Officer and my office on International Education Week 2025. Former Secretary of State Madeleine Albright captured the enduring spirit of International Education Week. When we open our doors, our academic institutions, and our mind to different cultures and ideas, we learn to recognize commonalities where once there were only differences, and we establish respect where once there was only fear. This mutual understanding is what makes international education an effective incubator for creating long-lasting global alliances. Statespeople like Madeleine Albright, an American diplomat who was the first woman to serve as the United States Secretary of State and was an immigrant from then Czechoslovakia, understood that fear and distrust can manifest naturally within the human condition, while a simple antidote to the fear and distrust is international educational exchange, which fosters humility, friendship, and fraternity. IEW doesn't just celebrate lofty ideals of elevated humanity. Rather, IEW highlights very practical, real, and tangible ways all of us are better humans and how our lives are enriched by KUMC welcoming international students, scholars, and visitors to our campus, and by our community members traveling internationally to engage and collaborate with university partners around the world. Here at KUMC, we know well how much our international friends and colleagues contribute to our community and how grateful we are that they choose to work, study, and or do research here at KUMC. We know the value of individuals from around the world who come to the US to study and how their presence in America contribute even more profoundly than the billions they contribute yearly to higher education. The latest analysis finds that international students studying at US colleges and universities contribute over $42 billion, $230 million in Kansas alone, and support over 355,000 jobs in the US economy. For every 3 international students, 1 US job is created and supported by spending occurring in the higher education, accommodation, dining, retail, transportation, telecommunications, and health insurance sectors. International Education Week is a week for celebration, a celebration of diverse cultures, languages, people, and the relationships and connections we have forged here and across oceans and continents. This is a time to celebrate our friendships and to celebrate in our collective and individual accomplishments. Each one of us are part of international exchange because we are part of the KUMC community. IEW is about all of us as we exchange, listen, interact, and connect together. We celebrate the journey of those who come to KUMC, their presence and their immense contributions that enhance our lives every single day. International students, researchers, and employees are part of the heart of our institutions and are woven into the beautiful tapestry of American higher education and American society. We celebrate our faculty, researchers, and administrators who approach international exchange and global health with attitudes and efforts that reflect humility, inquisitiveness, and understanding. We celebrate our nearly 100 learners who seek to understand other healthcare systems, languages, and cultures through virtual and experiential learning opportunities. We celebrate our over 300 faculty who present at international conferences, who develop educational exchange opportunities, and who innovate and elevate healthcare education and patient care with international partners around the world. We celebrate our partners who engage with our KUMC community and host our learners and make deep learning experiences possible. Happy International Education Week. And speaking of individuals who present at international conferences, develop educational exchange, and work with our partners internationally, I can really think of no one better than Dr. Kovac. I don't know if Dr. Kovac wants to come up and say anything, but Dr. Kovac started this observership back in 2016, and it has just been amazing to get to see how it's grown. So, Dr. Kovac.
Well, I'd have to say thank you very much, and bienvenidos, Aquala, welcome. It has been quite a journey. I think 2016, when I first went to Lima, Peru in 2015. Okay, here we go. This will help. Okay. Yes, start over. Thank you. It's been quite a journey. In 2015, I went to Lima, Peru, met Dr. Juan Urquizo, and interesting enough, I still remember the day. He said, come back for a day, a week, a month. And so I did. And so in 2016, we started the bidirectional. I have a passion for global health education, but not only for going to the country, but having the country's participants come to KU, that bidirectional. And this is the 8th year. I'd have to say that we had 2 years we had to pause it because of COVID. So very glad that we can come back. I want to say hello to all my friends in Peru and Ghana. I know it's 1 hour later in Lima, but 6 hours later in Ghana. But this is not about me today. It's about our international visitors. And one of the beautiful things, I still remember Dr. Juan Urquizo, when I told him I was having residents come over, he said, I would like you to, if you can have the Peru residents come over at the same time as the Ghana resident. And that to me was a stroke of genius, than the fact that from two different continents and cultures, people can meet, and you see how the friendships blossom between Ghana and Peru. Today, it's tradition that they give a presentation at KU. Similar, when we go to Peru or Ghana, we give a presentation. And so our first presenter, Dr. Patricia Barrero Nueva from the Instituto Nacional Enfermedades Neoplásticas in Lima, Peru. Please.
Well, good afternoon. My name is Patricia Barrio Nuevo, and I am absolutely honored to be here at Kansas University Medical Center as one of the recipients of the COVAC International Observers. I have to. So, here, perfect. Thank you. So, so I'm very honored to be here in KUMC as one of the recipients of the COVAC International Observership Award. I come from INEN, located in Lima, Peru. Talking about my story, I was born in Lima, the capital of Peru. Peru is divided in 24 departments, equivalent to what it's here, a state, and one constitutional province. So Lima is a big city. It's 10 million people located in the coast of Peru. My family, that is the bedrock of my story. I am the third of 5 children. I have an older brother, 2 younger sisters, and another sister that remains in our memory. Our parents built a foundation of resilience, curiosity, and a lot of adventure. My father, a mechanical engineer, led our family actually on a global path. This instilled in me a lot of curiosity and a lot of skills for quickly settling in and thriving in new and very complex environments. Here are some pictures of myself. So in the top of the left, I have the chuyo, that is a Peruvian hat worn in the highlands of Peru. I'm in the middle of this picture with a few of my friends when I was in, I think it's kindergarten or something like that. And in the right, that's my family, my dad, my mom, my brother, and my sisters. We're in the Santa River in Ancash, that it's in the highlands of Peru. So that global path actually started when I was 8 years old. We moved to Ecuador, Quito, for 4 years. Ecuador, you can see it like it's the green country just above Peru. We stayed there for 4 years, and later on we moved to Venezuela. Valencia was a city. We moved to Valencia, Venezuela for another 4 years. That's the orange country that is also located in South America. These were actually more than just like travels during my childhood. They actually exposed me to continuous different education systems, to different cultures, no, and by navigating through those, I actually connect with new people. I develop soft skills of quick observation and resilience, the kind of skill that are actually essential for fast-paced clinical settings. In here in the pictures, you can see this picture in the left. I am at the Chimborazo. We have the Chimborazo Peak in the background. That's my family. So I'm actually the one holding the fishing pole with the black boots in the left. You cannot actually tell, but I do have like those surviving knives, two of them in my belt. And in the right, we're in one of the thousands of oil wells that are located all around Venezuela. So Venezuela is actually the country with most oil wells all around. Like they have over 3 billion oil barrels. So it's the top number one in the world about that. So actually, my most pivotal moment when I was during my youth years was when I was 15 years old. My parents asked me, though, what do you want to have a quinceañero? I don't know if you guys know about it. That is a very typical thing in Latin America, or to make a year do a exchange student year in the United States. And I decided to go. It was a very easy answer to me. So I chose the exchange year, and I spent a year here in Saginaw, Michigan, the red spot in the map. That year helped me solidify my English. It exposed me to the American culture, how things are in the educational level. It was actually a very important moment in my life, reinforced my hunger for global engagement, and paving me the way for my return here today. So these are just some pictures of that year with my friends, my American family, and I was actually like the goalie of the JV soccer team, and I played the flute in that for those years. So I was in the orchestra as well. So upon returning to Peru, even though I was always very sporty and actually would have loved to become a professional athlete, that was not an option, no? And I had to decide for a career. And I always liked science, so medicine was an easy choice. And I decided to study medicine, human medicine. I studied at Universidad Peruana Cayetano Heredia. That's my graduation day in the left picture. No, during those years, well, I got exposed to traveling around as well. No, we did a trip for 10 days in the jungles of Peru during our infectious disease course. And also in my last years, I was exposed to very good mentors in research. So I started developing some research skills. And I actually worked for a couple of years in that as a coordinator for the POISE-2 trial that was going on in Peru. So I started to get exposed in that. With my passion for research in those years, I applied for a research fellowship position in the United States. So in the years I followed, I actually focused my research in evidence-based medicine, in systematic reviews and meta-analysis. And that research was also, like the results of that research was mostly for the development of clinical guidelines. And that was for the diverse specialties from urology to endocrinology. There was some institution like in WHO that we actually got to work with as well. No, and crucially, this work was conducted in Mayo Clinic in Rochester, Minnesota. So that experience taught me the highest standard of research. I learned how to synthesize very complex data into actual findings that were going to be used in clinical guidelines. Well, the goal was always translation, just as I was saying, the results were for the clinical guidelines mainly. The most profound lesson during those years was actually what was more foundational, is what Mayo Clinic taught me by seeing how patients are treated in there. It ingrained in me the principle that you have to always look for the patient's needs first. That is something that even though my medical school did give me some first steps of that, it was very clear at Mayo Clinic. These are some pictures of me on the left with the Mayo brothers. I got a lot of snow while I was there, and that's my KS knowledge and synthesis unit team. You can see at the lower right, it's San Juan, one of my mentors, and my boss, and also my mentor that is above him, Hassan Murad. So after that period of very intense research, I actually returned in Peru in 2018. I was actually kind of facing like a professional life crisis at that moment. I love research, but I wasn't sure if I wanted to leave the patient's interface behind. So this uncertainty led me to do my serums, that is the mandatory rural service that you do in Peru if you want to apply to residency or you want to work as an administrative type of work as a physician. I did the serums in Bocapan Tumbes, that it's very in the top of the Peruvian map, the red spots. So that year was a lot of community service. There was in this health post, we would say, we were four: a nurse assistant, an obstetrician, and myself, the physician. So we would do any kind of work, like for 3 towns that were around the area. 2 of them were like near the beach, and there was another one that was like into the highlands of Tumbes. I do remember two special cases. No, one of them was when we detected a malaria case that was not haven't been detected like in 5 years. So we had to do an epidemic fence. That's what they called. So I had to go house by house searching for other active cases. And the way of getting there was by walking and by using a dirt bike that that health facility had. And another case, interesting case that I had in that year was a tuberculosis case. They hadn't had tuberculosis cases in that health post like for 10 years. So we had to be very strict in how we would give the medication. If the patient wouldn't come to the health post, we would have to go home and give it to the patient. We have to actually see that patient was putting those pills in the mouth. So it was very strict, because we didn't want that case to spread. So after that, after the serums year, I was offered a position as a consultant for health technology assessment at Esalud. Esalud is actually Peru's one of the largest healthcare systems. This was research on a massive scale. The assessments that we were doing that were kind of similar to the systematic reviews and meta-analysis were conducted actually to determine if a drug or a medical device was going to be approved for use. So there were millions of dollars in some cases on stake. So in some points, these, especially because COVID started just a few months after I started this position, you saw like there was intense pressure and risk involved, navigating into the political and the corporate interest from pharmaceutical companies and medical devices companies. But it gave me a lot of lessons, of integrity and other type of translation that you can do from research. So these were some meetings that we had at that team, de salud, pictures of them. And well, After nearly 2 years of this work that I had in a health technology assessment, I decided to apply to residency. After one failure, actually, after my rooms, I did apply to emergency, but I didn't get in. But I applied for another specialty, and I think it's a good thing that I didn't get in that opportunity, because it would have been very bad, because I really love anesthesia now. And I decided to reapply to residency, but this time into something actually unexpected happened. No, I found myself searching for specialties, and just after 4 hours of research, and because I saw that specialty anesthesiology and said, oh, I don't know too much about it. So I just made the research, and I said, well, it never crossed my mind. And I really, really like everything that is involved with this specialty. And I applied, and I got in, and I got into the best institution for me, that it's INEN, ¿no? Instituto Nacional de Enfermedades Neoplásicas. That is the major cancer center in Peru. So it has been for me a pleasure to do it in this place, with ups and downs of how is residency all over the place. No, this center is a highly specialized and has a lot of challenges. In Peru, that is Peru National Cancer Center, is the main referral of this type of patients from all over Peru. No, so there are other two regional centers, one in the North Peru, another one in the south of Peru, but INEN is the main one, no, that is in the capital, and is the national. Besides being the national reference for patients, is also like the main place, oncology-wise, to do research, and where other specialties get to do a rotation in for this type of patients. Just to give you a sense of the scale and focus that INEN has, the facility has 10 main operating rooms and additional 6 ambulatory operating rooms. So the specialties that are covered are pretty much all of them, except obstetric patients, and also cardiovascular patients that are covered in other national centers for those specifically. So the training is very focused, no, and very like hyper focused on high acuity oncological cases mainly. And here are some pictures of me like doing some. This one is a spinal anesthesia that was given. There is some part of the team at INEN. So with some of the residents from my younger years, and also some attendants that are in there. In the middle, bottom middle picture, that's my whole year residence. And in the just in the middle, there's Dr. Waman, that is the chair of anesthesiology, the one that is wearing black. If you can see that it's different, because the rest of us, we have to wear white if we're residents for the whole 3 years of training. And then there are other pictures with other residents from my same year or years below me. So now I want to talk about one of my other, something that is part of me, that is outside of my life in the hospital. Since 2007, I am also an active volunteer firefighter. This is more for me than a hobby. I've served in this for it'll be almost 18 years now. And even though I have had some pauses being active, because I was also traveling I was working outside of the country. It has been always what I like it to do, besides being a doctor. And well, in Lima, 80% of the firefighter calls are actually medical emergencies. So the firefighters have response to the medical part, and also fires and rescues in case of car accidents or any type of those type of emergencies. So, and this training has given me some complement as well, no, for my clinical life, teaching me how to operate in very um, extreme, like stressful situations, no, have to respond quickly, and also with limited resources and a lot of teamwork that is being done in any emergency. Additionally, since 2019, I have taken on a specialized role in the firefighting. I am part of the Canine Service and Rescue Team for the Task Force 1 USAR, that's called, in Lima. No, so we are a team of 7 or 8 people now in Lima doing this, and we have between 10 and 15 dogs. So I have 2 dogs. No, I work with my 2 incredible partners. That it's Zeus, a border collie, the one that is showing here in the left, and Cody is a golden retriever, is the one in the right. This team has actually taught me a lot of different things. No, demonstrates me that you have to be very persistent. No, the same as other things that have been going on in my life. No, persistent. You have to learn a lot of high technical level topics, no, because in doing this type of practices, you have to know about the wind, about how the search works for the dog, and a lot of complex problem solving that you have to know, and especially nonverbal communication and trust, with your dog. So that's something that have taught me a lot. So these are some pictures from those practices. We do like some practices in ropes with the dogs. They also have to learn how to wear uh, special goggles and shoes, and they have to be obedient, agile, and of course, besides doing the search. And well, this background is what I bring into this observership. And the Kovac Award is a tremendous opportunity to me. And I'm really thrilled, to be here along Ova from Ghana and Jorge and Jeanette from the Peruvian Society of Anesthesiology. This honor couldn't be possible thanks to Dr. Kovac, his generosity, his vision for connecting people, and his dedication for supporting physicians from diverse backgrounds as ours, including those coming from more resource-limited settings. His commitment opening doors at KUMC so others can learn, engage, and build lasting relationship is deeply inspiring. And I'm also grateful that Dr. Kovac connected with Dr. Urquizo a few years ago from INEN. Because of this partnership that still lasts, I have this extraordinary opportunity. So I'm very grateful for that. So looking back, these are just some of the Kovac awardees from INEN. You can see the first one was Delia, that right now is working in chronic pain in Spain. She actually wrote a children's book a couple of years ago, Pudin, that helps children to know about the OR and how the anesthesia is going to be, so it eases them. Then Luis Orbegoso and Jose Medina were well after her. Then Diana Pacheco in 2019. She's actually the academic coordinators for residents at INEN and have been doing an amazing job at that position. Jenny Cedron, that came in 2022, just finished the fellowship in cardiovascular anesthesia at the National Center in Peru. And lastly, Aki Vizcarra, that came in 2023. After that, she has been working at INEN as well. So here in KUMC, I have three clear goals. First, to observe advanced techniques that I haven't been exposed before in your high volume surgical services, to learn about the OR logistics and resources allocation to identify strategies that I can implement to improve efficiency back home, and to connect with faculties that are interested in discussing future collaborations in research. That would be good. So ultimately, my journey has equipped me with some blend of skills, adaptability from my global upbringing, research-driven decision-making from my time doing systematic reviews, meta-analysis, and technological health technology assessments, and also like the self-oriented resilience from my time since I've been a firefighter. So I'm very thrilled to be here, and I look forward for contributing to and learning from the exceptional team that you have here at KUMC. Thank you, and I welcome any questions. Mm-hmm.
Are there any questions for Patty? One thing that impressed me with Patty is her varied background of being in the U.S. before, doing research at Mayo, coming back to anesthesia, and her hobbies and her other life, especially as a firefighter or a bombero. You know, the one thing I look at that picture of all the dogs, that they got all the dogs to stay on the barrels at the same time, and that
one,
the dedication that you have.
Yeah,
Those are very dogs, and she's trained those.
Yeah, they're very obedient. We just told them stay, and they all stayed for the picture. Yeah.
So if I could ask you, Chris, so you had a background with research at Mayo, and do you have any aspirations or in the future of learning what you had in research, doing research, and if so, perhaps what type of research would you like to do?
So far, my interest right now in research, I have two main topics that have been in my mind for the last couple of years since when I was doing residency, and one is how some patients from the highlands respond differently to anesthesia. That is something that I have been discussing with other attendings in Peru at INEN. No, so that's something I would like to focus. But because of my background, I actually did kind of like a personal systematic review about it, and there's not any research done in that area. And I am guessing that it might be because I was asking those patients what they were exposed, and them chewing the coca leaves was something that is very common in the mountain people. So I was actually thinking maybe first do like some prevalence or as a first study about it, just to know like how common is that exposure and to what we're seeing in the anesthesia OR, during anesthesia in the OR. And the other thing that actually very interested me is about using music in the OR for easing the patient and calming them. So that's something that I want to do more research. I would like to start doing research in that, in back home. If there's someone interested here, that'll be great.
And yeah, you have such a variety of different types of music.
Yes.
Well, thank you very much.
Oh, thanks to you.
I have seen read case reports of music being used in the OR for pain and how it relates to pain and the amount of pain medications that are required post-op. There are case reports, and there is I remember reviewing one in residency, and there is a strong evidence or that if patients choose the music, going back to the OR and listen to music, going out to sleep, they have less pain requirements in post-op.
Exactly.
But I don't know how it's not an extensive, there's like several case reports, not big studies though, so that's probably.
Yes. So actually my thesis back home is about that. Not therapy music, because it's not delivered by a music professional, but music given by the anesthesia, by the anesthesia team. And yes, like, it's usually what has more evidence is that the patient choose the music more than you choosing the music for the patient. But we have so many backgrounds in music, and I it's actually like I'm remembered by a few of my attendings of the resident that always put music to the patients, and yes, I usually ask them. I would usually ask them what they want, and sometimes it's music I don't listen at all because they're from other places, all over Peru. So yeah.
I also have a question. I don't know. I don't know if I missed it, but I don't know how much of your adult life you lived in Ecuador and Venezuela.
Just during my childhood,
Just your childhood?
years since when I was 8 years old, and then another 4 years after.
Okay, my follow-up question was going to be what kind of similarities that you saw with like health disparities in those countries compared to in Peru, but
It's very similar actually. Like but while I was living in Venezuela, those were different moments for Venezuela because it was before Chavez was a president of that country, and actually Venezuela for that period was very, very similar to Miami for us. For us, it's like, oh, it's very decentralized, big cities, big roads. Like they didn't have limited resources like we had in Peru and those times. No, but there are different political issues in each country that makes the difference. No, yeah.
We did. Thank you.
Yeah.
Very interesting discussion. We can discuss that after.
Okay.
But we have 3 more.
Thank you very much.
Well, these next two are speakers. One thing that we have, I want to bring up, and shout out, saludos a mis amigos in Peru, especially at the Maternity Institute. And also I'd like to say saludos to Dr. Jorge Basulto. Our next 2 speakers, they're sponsored by the Peru Society of Anesthesiology. And it was a thing that initially we having through the COVAC Award, one from Peru and Ghana, Dr. Urquizo and Dr. Basulto thought that this would also be an opportunity for other residents in Peru. And so they have a competition. The next 2 residents were in a resident Congress competition, and they're the first and second place winners. Oops, sorry. One thing that our next speaker is Dr. Jorge Solsa from the Maternity and Perinatal Institute, and I'd also like to say hello to Dr. Dante Seguro at the Maternity Institute, and the fact that even this last year we've signed also a cooperative agreement between the Maternity Institute and KU. Please, Jorge.
Good afternoon. Hello. Good afternoon. I am very excited and grateful for this opportunity, Dr. Kovac and team Kovac. My name is Jorge Robert, and last name is Sol Figueroa, and country in Peru, and city in Lima, and I speak three languages: español, buenas tardes, English, good afternoon, in Portuguese, boa tarde, gente. Peru is okay. Peru is located in South America, bordering Ecuador, and Colombia to the north, Brazil to the east, and Bolivia to the southeast, and Chile to the south, and Pacific Ocean to the west. Peru have 24 states. My city is in Peru, in Lima, Peru. This is my family. She's my grandmother. My grandmother is a housewife. He's my grandfather, my father. My father is a sailor. It's in my total family. She's my sister. My sister, her name is Silvana. Another sister is Vanessa. Silvana is a psychology, and Vanessa is a medical student at the moment. Now, timeline on my life. I was born in the Naval Hospital of Callao. Callao is a state in Peru, in the provincia of Callao. I study a primary school and high school at the German Aztec School, is the name. In this photo, we can see my friend from high school in the total friends in graduate. I started university in University Ricardo Palma in 2005, and the Ricardo Palma Private University. I finished university 2014, and this photo is my best friend. I remember because he's very funny. As for, his name is Ricardo. Then is a complete serum. Serum is a rural and marginal urban health service. It's a health service that the Peruvian doctor do for 1 year and finish the university. It's not necessary as obligatory, these serums. In Ancash, Peru, I'm my resident. I finished my resident at the National Maternity and Perinatal Institute 3 months ago. It's an institute, maternity, in Peru, in Lima, Peru. The total resident, we are a total of 18 residents 4 years. And is anesthesiology actually working 34 anesthesiology in maternity leave. This is general information on service and maternity hospital. And the most frequent age, 20 34 years. And the hospital has 20,000 buyers per year. And 4 months is 1,000. Per day is 13 beds. Vaginal deliveries is approximately 6,000 per year. And cesarean section is 7,000 per year. In 4 months is about 400 and 600. Epidural anesthesia 300 per year, and spinal anesthesia is 6,000 per year. This is a lot of epidural and spinal anesthesia in maternity hospital. I start the resident in 2022. In this picture is my 2 colleagues, Gandhi and Milena. And In maternity hospital, the lateral decubitus position is the most frequent way to administer spinal and epidural anesthesia. It's for comfort the patient. We use ultrasound difficult bags. In maternity hospital, have a lot of difficult bags. In the third years, we rotate for a month in the neonatal UCI. We observed two different surgeries neonatals in maternity hospital, performed at the hospital for 1 day, all have 2 months old. In this picture is the different surgeries in neonatal. It's myelomeningocele. In this picture is complete my resident, and he is Dr. Segura, my professor and chief of the anesthesiology department. This is my friend. I love a conference in Latin America, in Medellin, Colombia, 1 month ago. It's a Second World Congress of Obstetric. In Sao Paulo, Brazil, is a Congress Paulista de Anesthesiology. In Lima, Peru, a different Congress, and I love POCUS. And rotation abroad in Sao Paulo, Brazil, regional blocks in Brazil. Here I'm resident of the University of Sao Paulo. In the photo, we see my teacher and friend, Margarita. Is a best person. And in the other month, I rotate cardiovascular anesthesia in Sao Paulo, in INCOR in Sao Paulo. In the future, I will do the fellowship in anesthesia cardiovascular. I love obstetric anesthesia and cardiovascular anesthesia. My hobbies is play football, and he is an official team of the Lima Maternity Hospital. Here's Dr. Dante Segura. He's a chief of anesthesiology in the department of anesthesiology in maternity, and he's Dr. Arenas. My other hobbies is explore different countries and cultures. For example, in Medellin, Colombia, I visited 1 month ago. And this is Peñón de Guatapé in Colombia. In Rio de Janeiro. Here the photo is from Paulista Avenue in Sao Paulo. It is a very long avenue, approximately 60 blocks. This photo is in Fortaleza, in north of Brazil. I travel into Peru. The coast of Peru. The photo is in Ica, Peru. The dunes in Ica. Is a mountain of Peru. In this photo is Parón Lagoon. In this other photo is in Ayacucho, Peru. My family is from the jungle, and I love going back every year to visit my friends and family in Tarapoto. The photo is a different picture in Tarapoto. This is a lagoon Sauce in Tarapoto. I love this lagoon. My passion is a similar Patty. My passion is I am 5'5", of the San Juan del Urigancho. And in 5 department, take motto. The motto is firefighter of San Juan del Urigancho, always lending a hand. For this photo. This is another photo, is my passion. He is my best friend and teacher. His name is Alex Contreras. And he has done very last fact in Lima. In this picture, her teaching CPR to the children of Lima. It's very important for a fire department that teach CPR. And my other family in this photo is my friend, firefighter, in my family, my father and my sister. Awards, anesthesia for cesarean section in a patient with cerebral arteriovenous malformation is my award. And now, welcome to Peru. We look forward to seeing Tucson at the Lima Maternity Hospital. Thank you.
Any questions for Jorge? I guess one thing I would ask, so have you finished your training at the Maternity Institute? Do you hope to do obstetric anesthesia, or what are your plans regarding that in the future?
And I love obstetric anesthesia and cardiovascular anesthesia. But in the future, I fellowship in cardiovascular anesthesia is to obstetric anesthesia.
Maybe do a fellowship?
A fellowship, yes.
Okay. Well, thank you very much.
Thank you.
Okay, our next speaker, I would say this, the SPAR, the Peruvian Society sponsors two. And so this next one, Dr. Jeanette Acosta. She's from Honorio Delgado Hospital in Arequipa, Peru.
Okay. Good afternoon, everyone. My name is Janet Graciela Acosta Chauca. I am from Peru, and it's an honor to be here in front of you today in the International Observership of the University of Kansas Medical Center. First of all, I want to express my gratitude to the University of Kansas Medical Center, to Dr. Kovac, an exceptional human being, and his team, and the Peruvian Society of Anesthesia, Analgesia, and Resuscitation. I don't know if someone knows what it is, the Dirac equation. So that equation says, even if two systems interact with each other for a certain period of time, and then separate, they will continue to influence each other despite the distance. So I think that is the maximum purpose of this exchange process. This is me. I am an anesthesiologist. I am from Arequipa, Peru. My friend says Peru has 24 states or departments. Arequipa is also a city in the department. In the mountains, is around 7,000 feet above sea level. This is my city, and this big mountain is one of the 3 volcanoes that surround it, inactive volcanoes. My another great job is being a mom of 3 children. And my favorite pastime is traveling. I studied medicine in the San Agustin University. I do my residence too. I worked for 1 year in the Rural and Marginal Urban Health Service in Peru, in Coquechacra, Arequipa, Peru too. This is another town It's near to the sea. It's not in the mountains. And I basically did preventive medicine. So if a patient didn't come to the health center, we have to go to look for the patients. This is my hospital, Honorio Delgado Hospital. It's a hospital at the 3rd level. We have 540 beds. We serve patients for all the south of Peru. We have attention in pediatrics, ICU, intermedicine, gynecology, obstetrics, surgery, and the OR, neurosurgery, pneumology, and we have a special area for patients with tuberculosis. Tuberculosis is a prevalent disease in Peru. We receive as patients for 8 departments. This is the department of anesthesia. We have 35 attendings, 12 residents, 4 per year, 25 nurses of OR, no nurse anesthesiologist. There is not nurse anesthesiologist in Peru, 10 nursing technicians. We also have 10 operating rooms for surgery in newborns, pediatric surgery, cardiothoracic surgery, gynecology and obstetrics, trauma, orthopedics, ophthalmology, otolaryngology, abdominal surgery, urology, plastic surgery, and the burn unit. We do TIBA with TCI. Is a difference with this country. And my friends show how the anesthesiologists go to the fire station. So I am gonna show how the firefighters come to the operating room. It was an emergency. It was a child whose hand was trapped in a meat shredder, and the firefighters come to cut the machine to rescue the hand. It was successful, yeah. We also have different surgeries, big surgeries. I am here thanks to the COVAC International Observership Award. It's a contest organized by the Peruvian Society of Anesthesia, Analgesia, and Resuscitation with an original review that is updates in the perioperative management of postpartum hemorrhage. That was an impulse for me to achieve another goals after that. And well, being here, I have had the opportunity to work with highly trained and motivated health teams, and to meet health system with more resource and advanced technology. So, which has inspired to me to look for opportunities to improve my own practice and contribute to the development of healthy care in my country. Thank you. Gracias.
Are there any questions for Janet? One thing, I think that one picture showing the firefighters or the bomberos coming into the operating room was pretty dramatic. But also, was that not like a 7 or 8 year old?
Yeah, 8-year-olds. Yeah.
And I know she told me a little bit before that. And then you put the child asleep, and then they cut the machine off.
Yeah, it was successful. They rescued the hand. Yeah.
See, one question I would say, at times when I've gone to Guinea or Peru to learn TCI, target controlled infusion, with propofol or remifentanil, I think if you have the opportunity to go to Cambridge, maybe Dr. Leslie or Dr. Jacobs, and see our methods, knowing how to do TCI, and then maybe seeing our method. Do you have any opinions, what you think about that?
Both systems are good. I was talking with my friends, so we have to choose a model. We have to do take note about a different weight, age, gender. So it's easy and it works to work with an infusion. Yeah.
Okay. Well, thank you.
Thank you.
Hello. And I hope our friends in Ghana are still with us, especially with Dr. Alfred Adu. I want to just shout out to Dr. Alfred Adu because he's our connection in Ghana. And these connections and people in Peru and Ghana, they can make a visit much easier. They can make our ability to get papers signed or where to go. And I'd like to introduce our next speaker. She has a long last name, so I'm going to let her tell that. But if you'd please come up here, Dr. Oba. And she's from the Pamfanochi Teaching Hospital in Kumasi, Ghana.
Good evening. I'm excited to be here this evening, all the way from Ghana to the United States. So my name, even as a Ghanaian, is quite long. It's Oba Opinion, Esi Safo Bransama Akwanyaku. Oba in Akan language, that's one of the most commonest languages in Ghana, means girl or woman. So you meet someone and they say Oba, and they're most likely calling a girl, but it's my name. And Pinyin means elder or an older person. So when the name is combined, it's actually a title given to people who are known to be wise, wise women, given to our queen mothers because they are the kingmakers of the society. AC is a name given to me because I was born on a Sunday. In Ghana, we have a system whereby depending on the day you were born, you are giving a name. So you'd come to Ghana and you find a lot of Kofis, you find a lot of Kwabenas, like Kwabena Latte. You find a lot of Kwesis because Kwesi was born on a Sunday. So as long as you're born on a Sunday, automatically you have the name Kwesi. If you're born on a Sunday and you're a female, depending on which part of the country you are, you're either Esi or Akosia. Safo was given to me because my dad named me after his mom, and Bransma because he named me after his dad. Some people ask me why. Did he think he was not going to give birth again? He gave me all the names he could think about. Yeah, but that's my middle names. Then I was Anakwa. That's my maiden name. This is my family. This is my mom, my little sister, who is now an engineer. My dad is a civil engineer. Actually, my dad taught my little sister in school. This is my brother, who is a lawyer. So I'm the firstborn of three, and it's actually fitting that I have the name Oba Opinion because then it indicates that I am the first girl. There's another picture of my family, a closer picture. You can see we all have the same smiles, all the 32. Currently married, and that makes me an Akwanyako, or Akwanyako, yes. My husband was Nyako, and to make a new name, we joined our names together, and that is the new name now, Akwanyako. And we have two boys, energetic boys, and that's them on the screen. So I'm from Ghana, which is in Africa. Yeah, Africa is the second largest continent in the world, made up of 54 sovereign countries. And Ghana is located in the western part of Africa, West Africa. And it's a country that spans 239,567 square kilometers, made up of 35 million people. In comparison with Kansas, is slightly larger than Kansas, about 13%. Made up of 16 regions, what you term as states. It's multi-ethnic. So we have a lot of ethnic groups, but there are 6 main ethnic groups, and Akan, of which I'm part of, is the largest ethnic group. And even that is a polyethnic group. So we have people like the Ashantis or Asante, Fante, Bono, Achim, amongst others. English is the official language, and we have over 80 indigenous languages. So as I said, I'm Fanti, so I'm Akan. Fantis are mainly located in the central region. That's here. The closest known city is Accra, borders it to the east. And Ashanti is to the north of central region. My hometown is a landlocked community in the central region known as Ejumakun Bisiase. Some facts, stereotypes about central region is that it was the hub for the slave trade. It was the final destination that people all over Africa, all over Ghana came to before they were transported across the Atlantic. And 2 known castles that are located in the central region include the Cape Coast and Elmina castles. We have the best secondary schools in the central region. We're known for seafood also because we're close to the coast. And Fantis or people in the central region are also known for being very experimental and very English or foreign or exotic with their foods because of that close relationship they had with their, shall I say, colonial masters or with the British whilst they were there. And because of that also, we are known to speak English more than any other region. We are a fun-loving, humorous people. If you have someone who tends to crack jokes, tends to be funny, most of the time they are from the central region. And another thing is we have long names, as you can see. Okay, so there's a few attractions in the central region. Not if, but when you guys come over to Ghana, these are the things that you would see. The Kakum National Park, which is a 350 meters canopy walk, up 30 meters above the ground. This is Cape Coast Castle, one of the final destinations for the slaves when they were brought to the coast to be transported to the across the Atlantic. We also have the Elmina Castle and the Asin Mansu Slave River, where the slaves had their final bath before being housed in the castles and the forts. Then I stay in the Ashanti region. The biggest city in the Ashanti region is Kumasi. And this is the flag of the Ashanti. And I was talking to Dr. Sheldon the other time, and I told him how the colors of the Jamaican flag are similar to the colors of the Ashanti, and it's because some of the indigents of Ashanti actually now reside in Jamaica. This is our paramount chief, the overlord of the Ashanti region, Otumfuo Nana Osei Tutu II. He's a very powerful man in the Ashanti region. Very recently, we had a funeral because his queen mother, so that was his sister, died. And as a result of that, there was a day that in the Ashanti region, no one had to go out to work, to school, because we were observing her funeral. So he's a very powerful man in Ashanti. So some of the facts, it's in Tree, they are called Asantefo, but in English, they are known as the Ashanti. They're known for the gold, for the cocoa, for the kente cloth, which has just received a geographical indication given by a World Trade Organization to show that kente made in Ghana is the authentic cloth. Yes, to safeguard the authenticity of the kente cloth. We also have Kejitia, which is one of the largest open-air markets in West Africa. It's a very lively, fun, crowded place, but it's very colorful. Ashantis are known to have generally short statures, and they are very proud of their tribe, of their culture, and it's one thing I love about them. Okay, so this is an example of the kente cloth. Actually, kente is home to two regions, or there are two regions that stake a claim on kente. But the most commonly known one is the Ashanti Bongre kente. So that's what we have here in the middle. And we also have the Ewe kete, which is worn by someone standing here. So this was the School of Medical Sciences. This year, we celebrated our 50th anniversary, and kente is worn during these occasions as a ceremonial cloth. This is Lake Bosomtwe. It's a natural lake, one of 6 in the world, was created by meteorite impact and is located in the Ashanti region. It's about 250 meters deep from its deepest side, and it's a place of a lot of culture, a lot of heritage there as well. Okay, so I had my education, primary and junior high school in a private school in Kumasi, known as Maria Montessori School. I had the opportunity of working there as a volunteer teacher after my secondary school education. I taught from class 1 to 3, and after that year, I had massive respect for my class 1 teacher because it's not easy teaching toddlers. After my high school education, I did my senior high school at Wesley Girls High School, located in the central region of Ghana, and then moved to back to Kumasi for my medical school education at the Kwame Nkrumah University of Science and Technology. So there we do it in 2 degrees. So the first degree is in a BSc of Human Biology, then a second degree after 3 years in Bachelor of Medicine, Bachelor of Surgery. I then continued after my education, I started work at Konfanochi Teaching Hospital. These are a few pictures. This is the entrance of the hospital. This is the most likely building you would encounter when you come to Kumasi, to Konfanochi for our bidirectional exchange, and that's our accident and emergency center. It was built in 2008 by the then president of Ghana, His Excellency John Ajay Kufuor, and it's been a massive help to the region. Very recently, actually this year in June, we opened the National Cleft Care Center, which serves the whole of Africa. It serves as an opportunity for maxillofacial surgeons to be trained, and we do a lot of cleft surgeries in this building. Okay, so I work in the anesthesia and intensive care unit. This is our management team. I was telling Dr. Kovac that it was quite interesting to hear that you had a chairwoman now, Dr. Hendrin, and we also got our first chair head of department, who is a woman, Dr. Fosia Japon. And I think this year is the year for women. We have our head of ICU, Dr. Sian Frimpong, Dr. Nana Duboateng, lead clinician, and Dr. Sufaya Ankra, who was a former Kovac awardee, as our chief resident. So these are pictures of a day at work or with the team in anesthesia. So this is a nurse, and this is our pediatric theater. This is our ICU, some residents and attendings or specialists, as we call them, in the ICU, seeing to a patient. And this, we tend to have a lot of fun. We try to balance the work and play. And so every year we get together and do something fun. And this was one of the days we went to watch a movie at a cinema. this one, my favorite parts, favorite theaters in the hospital. This is the Kids OR. It's a pediatric dedicated theater, and it has 2 theater beds. So you'd go here and you have all the pediatric friendly equipment. You have the pediatric cuffs, the pediatric tubes, you have blood warmers, you have bed warmers. It's really equipped. It's the most, in my estimation, next to the Cleft Care Center, is the most equipped theater in Konfanochi Teaching Hospital. So Konfanochi, we have a 1,200 bed capacity. Initially was built for about 900, but because of the volume of cases that we take in every day, because we serve 13 out of the 16 regions, we tend to go above the 1,200 beds. We have currently 25 operating theaters, and they are not together, and each specialty has its theater can be located as far as 7-minute walk from the accident and emergency center. And we do neuroanesthesia, thoracic anesthesia, pediatric anesthesia, maxillofacial, ENT, general surgery, urology, plastics. It's a large scope of work that is done at Konfanochi Teaching Hospital. And we are currently 89 doctors in Konfanochi Teaching Hospital. If my memory serves me right, about 38 residents now. 18. Okay, so let me just skip this. Okay, so the pathway for residency in Konfanochi is that after medical school, we do a 2-year internship program known as a house job. And there we rotate through the major disciplines. So surgery, obstetrics, internal medicine, and pediatrics. But you have the option to switch out a surgery specialty for anesthesia or a medicine specialty for psychiatry. And that is what I did. And after the 2 years, you do a district rotation for 2 years before you are allowed to start a residency program. So after you being a house officer, you now become what we term a medical officer. And when you apply to either the Ghana College of Physicians and Surgeons or the West African College of Surgeons, you write a primaries, that's an examination, and then you are admitted into the Faculty of Anesthesia. So after that, it's 3 years, you write an exam, then you become either a member of the Ghana College of Surgeons or a member of the West Africa College of Surgeons. However, there's also an exam that you can write within a year of being in anesthesia that gives you a diploma in anesthesia. And it is a pathway that currently we are encouraging as many doctors as can to do to broaden the scope of anesthesia in our country, because we really have a shortage of anesthesiologists, and COVID really showed us that. So currently the diploma in anesthesia is open to all doctors as long as you do 1 year in anesthesia. And it's done by both the Ghana College and the West African College. So after being a member of the Ghana College of Surgeons, or a specialist, or an attending, as it's termed here in the States, you then apply again to the college if you want to do your fellowship. And currently in Ghana, we do fellowships in pediatric anesthesia, cardiothoracic anesthesia, neuroanesthesia, regional and pain, critical care, and general anesthesia. All these are done in Konfanochi currently. Okay, so, wow, ooh, sorry. Okay, so when you see a cohort of doctors in the hospital, it can be made of all the ranks. So you have from consultants, fellows, to attending specialists or senior residents. Those are doctors who are currently doing their fellowship. And then you have medical officers, residents, and house officers. Okay, this picture here shows we currently run a 3-month fellowship under the World Federation of Society of Anesthesiologists for regional and pain. And we have people come all over Africa to do that. And as I go on further, I'll show you how KU was very instrumental in us setting this up. This is some of the trainings we do for other doctors in Konfanochi Teaching Hospital on ACLS. So these are some of our equipment. This sonocyte, even though is very old, but it's one of our best scans for regional anesthesia. This is one of the ICU machines. And this was us when we celebrated the Ether Day. Ether Day is a big thing in Ghana, and we celebrate it every year. And this machine you see here, we term Cleopatra, because when it was brought to us from KU, it was wrapped like a mummy. and it's currently the machine that we use in the pediatric theater, the kids who are for pediatric regional anesthesia. Okay, so we are fairly well resourced, but there are gaps that we are catching up to fill up on. And I wanted to just talk about one of these cases I did. It was a pediatric, it was a baby, a neonate, actually a day old, about 2 kilos, had been diagnosed with jejunal atresia, and it had to be done as an emergency. And during emergency duty or on-call duty, the kids OR is closed because we do not have enough staffing. So we have to do it in an adult theater. So therefore, we do not have all the fanciful things that are located in the kids OR, but we try to make do, because the fact that you don't have does not mean work does not go on. So you can see here, these are gloves filled with hot water to try and warm the bed before the baby comes in. Most of the time, you find out that the AC in the theater has been turned off to further warm, to keep the place warm. This is our standard setup for a pediatric case. You can see a pediatric ambu bag, pediatric ET tube cuff. You have your face masks, oropharyngeals, and our Miller laryngoscope. So here we have a warming device, and we use the Datex Omeda and Draeger ventilators mostly in our ORs. Okay, so this was the baby. As you can see, during induction, we still had to keep him covered. And before we moved him into position, you can see the pediatric surgeon testing to make sure that the diathermy pad was not too cold. Okay, so one thing I've seen in KU and I've loved is the EMRS and how it's linked to your monitoring system. We don't have that, unfortunately. So we still chart that, and this is our anesthetic record form. So because of these shortfalls, we tend to have cases that, especially for the pediatric cases, that tend to keep long to recover, because at the time that you are done, even with all these DIYs, you still have a cold baby at the end. And it's something that we have learned to take note of and ensure that these babies are kept at post-op to ensure that they are still kept warm and ensure full recovery before being sent to the recovery ward. History with KUMC. So back in, I think, 2010, 2012, Dr. Alfred Adu met Dr. Mark. Then he was a medical student at Konfanochi Teaching Hospital because then he was doing an observership with orthopedic surgery. Then Dr. Adu was also a medical officer with trauma and orthopedics. So as they became friends, actually did some researches together, and at the end of everything, Mark came back to the States, got matched to KU to do anesthesia. Actually, Alfred had also started his residency in anesthesia, so then the friendship continued. And in 2016, he extended a hand of invitation to Alfred to come to KU for an observership. And when he came, he met the wonderful, exceptional man who is Dr. Kovac. And in talking to Alfred, the one thing he said that stuck with me was Dr. Kovac asked him, "What help can we give you to help you back home with anesthesia?" And the help has been tremendous because through Mark and Dr. Adu, the collaboration was set up between Konfanochi and Kansas University. It had already started with Peru the year before, but then now we were added to the mix, and a bi-directional exchange was started, and we've had people come to Kansas, we've had people come to Ghana, and the collaboration, the experience that people get in the observership, the friendships that are struck, they have continued over the years. And we are very grateful as a hospital that we have, or as a department, that we have this collaboration with Kansas U. Currently, it hasn't died down. Like, Dr. Kovac is still active, still forging new collaborations. It has even extended beyond anesthesia through Dr. Kankam and her husband, Dr. Sterling. The plastic surgery also has established a collaboration with Kansas University, and we have Professor Butterworth, who came down this year, and here he is in a meeting with the Ashanti Regional Minister, who is also actually a medical doctor, one of the youngest regional ministers we've had. He's really making waves in the Ashanti region, and the future really looks bright for Ashanti and health. Actually, this is a meeting with the current mayor of Kumasi, Honorable Richard Ajeman Buedi. This year too, we had, is now even moved from Ashanti region, now going to Greater Accra. Most of the time, when projects come to Ghana, they come to the capital first, they now move into the hinterlands. But I'm proud to say that this collaboration started in Kumasi and is now spreading out to the rest of the country. Here we have Dr. Kovac meeting with the 37 Military Hospital, and a collaboration will be established soon. This is Dr. Kovac with my mentor, Konfanochi's first to be pediatric anesthesiologist, Dr. Anastasia Ohene, a very lovely person who was also a Kovac awardee. So I've spoken about the impacts the KU collaboration has had over the years. We currently run a 3-month fellowship because our relationship with Mark, actually, Mark is now with HSS. And because of that, we have trainings from the regional and pain fellows coming to Kumasi to help train some of our residents. And now, Confanoche, I can say with my chest out that Confanoche is one of the centers who does the most regional anesthesia for our orthopedics. And currently, Dr. Kovac has a program running with the Ghana National Ambulance Service. That's the Helping Babies Breathe, because in Ghana, the National Ambulance is the first responder at emergencies. So it's very important that they know how to assess, and manage neonates as well. And we also have a collaboration amongst respiratory therapists led by Prof. Lisa Trujillo, that's under the Global Health program run here at KU. Okay, so these are some of the COVAC awardees. We have Dr. Martin Dickens, who was the first awardee. She's currently a regional and pain fellow, making massive strides in Kumasi. We've set up a pain clinic at the Confanoche Teaching Hospital, and it's still in the early stages, but there's so much potential to be gotten from there. And Dr. Anastasia Ohene, also she's with a Smile Train, runs courses for BLS, Pediatric Advanced Life Support, and doing marvelous things in Confanoche. We have Dr. Irene Bando, who is a female intensivist. She's now a critical care fellow. And Dr. Sophia Ankra, currently our chief resident, managing over 80 people and making sure that the schedules are run, making sure that everybody is available. It's not easy trying to manage adults and ensuring that schedules run effectively, and she does a marvelous job at that. We have Dr. Samuel Cranting, who is currently doing neuroanesthesia. Dr. Ama was here last year, and she also is, they are all into training and making and ensuring that residents are on top of, I don't know how to say it, but then they are ensuring that like training goes on in residency, ensuring that skills are acquired. Ama is part of the team that ensures that people preparing for exams are adequately prepared. And she's a very fantastic teacher. Okay, so from Leo Tolstoy, just as one candle lights another and can light thousands of other candles, so one heart illuminates another heart and can illuminate thousands of other hearts. Dr. Kovac and Mark have touched us at Confanoche, and in our small way, we are making sure that our systems are better each year, each day, each second. And we want to say thank you very much for this opportunity. I have really learned a lot. I'm currently going to do my fellowship in cardiothoracic anesthesia, and coming to KU, I knew I was going to see cardiac cases because we do not have an established cardiac theater in Confanoche. And since I've been here, it's been great. I have had a better understanding of how to treat my patients. I've had a better understanding of how efficient systems can be if each person does their work. And I'm going back with that candle to light other candles and make Confanoche a better system. Thank you very much. Medasi. So nipa ya adia or say ayeyi. If someone does well, he deserves all the praise. And for that, I want to say, Dr. Kovac, thank you. Yedase pa nyame onshraw kesi. Thank you.
Thank you very much. Actually, a question I was going to ask you was how did coming to Kansas and how did the collaboration help Kath? And you've answered that. What I'm going to say with of that a lot of equipment like with that mic and the ultrasound machine. I have to thank the University of Kansas Hospital.
Yeah.
Generous that they upgraded some equipment. Similar thing is they upgraded with the glide scope. So I'll say, what are you going to do with that? Okay, well, we could give that donated to the Confidential. One thing I have to say, we're I think blessed in our apartment that we have a global health resident, Bob Alarkin.
Yeah.
Who was also from Ghana. And that we have the different connections with Dr. Serafina Cancum, and that we will have some residents from going with Dr. Sheldon to Ghana in February, March. And I think the whole thing with our global health education, that we can also have residents that will then go also to Peru, that can go to Beaman Maternity Hospital or others. Any questions you would like to ask Boba? Or do we have a comment? But maybe Kwabena, you might like to say with regard to global health or global health bi-directional with Ghana, since you yourself are Ghanaian.
Yeah. I mean, it's been great listening to all the presentations. I think it's really great to have this bi-directional exchange program where we have people going from here to Peru and to Ghana, and having people coming from Ghana and Peru to here as well. I think there are things that we can learn from them, and there are things that obviously they can also learn from us. And I mean, Oba was just talking about some of the ways they improvise to provide care, and I think those are things that we can kind of build on and kind of think of ways we can come up with research ideas to further our collaboration and kind of deepen this partnership.
Okay, well, thank you, Mike, very much for attending and for our international.
Louisa, did you have a question?
But I was to mention that it is will be and that OIP, Office of International Programs, will make that available.
Louisa, please go ahead.
All right, thank you. My name is Louisa. I'm from Ghana and I work at Confidential Teaching Hospital. And to Dr. Wapenyin, a very excellent presentation. You made me super proud to be a Ghanaian. For those of us back home, we just want to know how different working in KUS from working in Ghana. How different is the system?
Okay, Louisa. In terms of management principles, is the same. But the major difference between KU and Confanoche is efficiency. In KU, you have people who do their job at the time they're doing it, at the time they are supposed to do it, and do it effectively. We don't have a lot of the turnover between cases is really rapid as compared to Ghana. And I think in short, that's what I would say is the efficiency. The efficiency in KU is much more compared to Ghana. Yeah.
Thank you.
I have a quick question for each of the residents. This is Kimberly from the Office of International Programs, and I'm the Senior International Officer and the Director. I'm curious from each of you, what is the one thing that you've learned or that you've experienced that you will take home with you from KUMC?
Okay, so personally, one thing I noticed is how, as doctors in anesthesia, we are in KU, they are very attentive to the condition of a patient pre-op. So you have a patient coming for a surgery, can see he's anxious, and in addition to talking, we all know, and actually we do have midazolam in our center, but we are very conservative when it comes to drug administration. So even though we tend to rely on what we term, I don't know if that's the same thing here, we tend to rely on Verbacaine to ease anxiolysis, more talking. I think we also need to understand that as anesthesiologists, we do have drugs at our disposal. And if you have patients who, you should be attentive to your patients. Don't think that it's blanket for everybody. If you have someone who is really anxious, there's nothing that stops me as a doctor, as an anesthesiologist, to ease their anxiety in addition to Verbacaine. Yeah, that's for me.
Hi, Kimberly. Thank you for your question. There are many things I think that have surprised me in terms of some resources that we don't have and how still like we at the end do the job. No? But something that really surprised me and in Peru being a low resource setting kind of place is that we tend to put a lot of how do you put it? In some cases, especially for chronic pain, for management of chronic pain, we tend to put a lot of drapes and use a lot of resources in that situation. That here is very different. It's like just a small area, you cover it, you do the procedure, and that's it. So maybe us that we're limited in resources, we're using much more than we're supposed to, in some situations, and you have zero infection rates. So that's something maybe we have to look around in our place, no? If maybe we can improve and use less resources in that.
Very interesting. Thank you.
A big difference, I think is obvious, is the amount of resource. Yeah. So I am going to come back to Peru, and the resource is going to be the same, but I am not the same. And this is not about the resource only, it's about the people. So how Oba says, Patty says, I can see how is a health system when the people do that it's supposed to have to do and do that in a correct form. So it motivates to me to be better person, a better doctor, learn more, and do how I read in the six-pack elevators, give the best attention possible to a patient. Why not? Why not in my hospital with our resources? But we can be that the change to do the best attention possible for a person. Thank you.
That was beautiful. Thank you. Inspirational, truly.
And I see Dr. Adu is with us and has raised his hand.
Yeah, thank you very much. It's good to see you. Just to say a big thank you to all of you who have made this successful. Kova, Kimberly, Alexa, the whole team. And just like Kimberly said, it's very refreshing to hear the impact that this, even though it's a short visit, the impact and transformation that it makes on the physicians, and they come back, and we are forming a core group of people who have seen things being done differently. It helps us here to also receive those who are coming from KU to CATH better, and to fashion out things that will be exciting and make the time they spend here worthwhile. Thank you very much.
It is our pleasure, Dr. Adu, and I love getting to see how the collaboration continues even after the fact as well, by either email or even just Zoom meetings, knowing that it doesn't end after these 2 weeks.
Yeah, thank you.
Well, if there are no other questions, oh, I stand corrected.
I just wanted to say thank you to all those who are listening in from Ghana. It's 6 hours, so it's about almost 11.
Almost midnight.
Yes, almost midnight.
It's midnight. 2 more minutes.
And they stayed up to listen. I really appreciate it. I thank you for your support, your encouragement, and to my family. I can see all of them on the call. My mom, my dad, my siblings, my husband. Thank you very much. God bless you.
Yes. And thank you all for joining us, either in person or online. We hope you will join us for the remainder of our events this week. Thank you all so much.